Syphilis victims in United States study went untreated for 40 years. It would turn out Charlie and the other 400 men in this medical program, they didn't have bad blood. That was just kind of a made-up term to get them not to ask any questions. What they had was syphilis, a deadly disease that ravages the human body in 3 stages that can unfold over a lifetime. And so these doctors that treated Charlie were not actually treating him. They knew he had syphilis. That was why he was even part of the program to begin with. When they tested his blood, they were trying to see who had syphilis in Macon County, and then they took those people and they entered them into this phony program, not to make them better, because this was not a treatment program. It was a US government-backed medical study of what happens to African American men with syphilis if their condition goes completely untreated for their entire lives. The leaders of the study did not care what happened to these men, and that point was made crystal clear when in the 1940s a cure for syphilis was discovered, penicillin. But instead of giving it to these men and saving their lives, they intentionally hid the cure from them and prevented them from getting it. This is why these men were not allowed to enlist in the military or seek outside medical care, because those doctors would discover these men had syphilis and they would just give them penicillin, curing them, but that screwed up the study, and so they couldn't have that. The Public Health Service chose Macon County, Alabama, because at the time, 35% of the population was already infected with syphilis, and because they knew the men in this town would be largely uneducated and poor and desperate, and therefore easy to trick into joining this highly unethical study. At least 28 men in this study died as a result of their syphilis infections, and countless others suffered from long-term side effects. Charlie was 66 years old when he heard the news. Finally, he had an answer. Bad blood meant he had syphilis, but fortunately his syphilis had either burned out or gone dormant. But he thought about all the other men in the study that had not been as lucky, and Charlie felt so betrayed by the government. He and the rest of the men had no idea they were getting taken advantage of. Charlie got in touch with a lawyer who eventually sued the federal government, and in an out-of-court settlement, Charlie and the other 73 survivors of the so-called Tuskegee experiment were given $38,000 each as compensation. After the settlement, Charlie just went back to his simple life in Macon County, and then 27 years later, on April 29th, 2000, Charlie passed away at the age of 94.